Neurological assessment is a systematic examination of the nervous system, evaluating the brain, spinal cord, cranial nerves, peripheral nerves, and muscles.
The spinal cord acts as the body's communication highway, transmitting signals between the brain and the rest of the body.
Today, we're doing something a little bit different. I want you to step into the shoes of a medical detective. Picture this. You're a doctor, you just walked into a hospital room, and you're staring down a complete neurological mystery. But here's the catch. Before you run any fancy brain scans or do any physical tests, you have to gather your most critical clues directly from the best source in the room, the patient. We're going to explore exactly how medical pros extract a patient's hidden story through targeted investigative questioning. Honestly, it's wild how much of medicine just starts with a really good conversation.
All right, here is our patient chart for today's investigation. We'll be moving quickly through 6 key areas: the art of subjective data, uncovering the chief complaints, investigating the present illness, checking systems and functions, patient background and history, and finally, documenting the assessment. Let's dive right in. Section 1, the art of subjective data. This is where we set the scene of our investigation. So what exactly is subjective data? Well, it consists entirely of the invisible symptoms that only the patient can feel. There's an old saying in medicine that 80% of a diagnosis comes from the patient's history alone, literally before a doctor even touches them. We draw this invisible data out using a really careful mix of broad, open-ended questions, followed by highly targeted follow-ups.
Moving on to Section 2, uncovering the chief complaint, or what we can call the inciting incident.
What brought you to the hospital today? This right here is the ultimate opening line for our medical detective. Or you might ask, what neurological symptoms are you experiencing? Or when did the problem actually start? These might sound like simple questions, but they're specifically designed to crack open the case. They give the patient the floor to tell you, in their very own words, exactly what is bothering them the absolute most in that moment. Usually, their answer is going to fall into one of these core categories. They might say they have a splitting headache, maybe a sudden weakness in their arm, or a family member might report that they just had a seizure. Whatever it happens to be, this chief complaint is our primary suspect. And once we have that suspect, we know exactly where to focus the rest of our interrogation. Which brings us to Section 3, investigating the present illness. Time for the interrogation. Now, as you'll see here, this is how we actually differentiate those symptoms. Let's look at the headache row. We don't just scribble down headache and call it a day. No way. We need to know when exactly did it start. Where is the pain? We make them rate it on a 0 to 10 scale. Is it constant or does it throb and go away? What makes it better or worse? And then look at dizziness. This is a classic diagnostic trap. Figuring out if a patient is just generally lightheaded versus the room physically spinning around them like true vertigo, that completely changes our entire investigative path. Okay, looking at the weakness category, I want you to notice that crucial middle question. Did it develop suddenly or gradually? Oh, and is one side more affected than the other? Think about it. A sudden weakness isolated to just one side of the body. That instantly sounds the alarm bells for a stroke. But a gradual, widespread weakness, that sends us down a totally different path. Same goes for numbness and tingling. We have to map out exactly where they feel it on their body and figure out if there's a total loss of sensation. Now, for major dramatic events like seizures or a total loss of consciousness, our questioning strategy has to pivot. Why? Because the patient was probably totally unaware while it was happening. So we need to piece together the exact sequence of events. We ask about warning signs right before it happened, how long it lasted, all that stuff. And crucially, we have to know if anyone witnessed it. If there's a witness, they become our star testifier. It's actually fascinating. Witnesses often notice subtle warning signs seconds before the patient even realizes what's happening, giving us objective clues the patient simply can't. All right, Section 4, checking systems and functions. In detective terms, this is canvassing the area. We start by checking their mental status and sleep history. We're asking if they've noticed any memory problems, recent confusion, or maybe they just can't concentrate. We even ask about changes in mood or behavior. Believe it or not, sometimes a serious neurological issue first shows up as just a subtle shift in personality. We also want to know how many hours they're sleeping and if they actually feel rested. Bad sleep can literally be both a symptom and a cause of neurological distress. Then we divide and conquer. We systematically run through the sensory symptoms. Any blurred or double vision? Is there a ringing in the ears? Weird changes in taste or smell?
And right alongside that, we're checking motor function and balance. Have they taken any falls recently? Are they wobbly when they walk? Dropping their coffee mug in the morning? By running through this checklist, we're making sure absolutely no stone is left unturned in our functional review of the nervous system.
Section 5. Patient backgrounds and history. Time for the background check. Notice the really vital contrast here. On the left, we're digging into the patient's own past medical history. Like, have they had a head injury before? Do they have hypertension or diabetes, which we know skyrockets stroke risk? But then, on the right, we contrast that with their family history. We're asking if conditions like Alzheimer's, Parkinson's, or even bad migraines run in their genetics. So many neurological conditions leave a very clear hereditary paper trail. Honestly, discovering that a parent had the exact same symptoms can blow a case wide open. We wrap up this background check by looking at the patient's daily inputs, their medications, and their social history. We need a list of all current medications. And fun fact, patients almost always forget that over-the-counter vitamins actually count. We also dig into their lifestyle: smoking, alcohol, recreational drug use. Finally, we ask what they do for a living. Have they been exposed to harsh chemicals or toxins at work? Sometimes the real culprit isn't a disease at all. It's an environmental factor they're exposed to every single day.
And finally, Section 6, documenting the assessment, closing the file.
Looking at this from a bird's-eye view, this complete 11-step history-taking process forms our subjective assessment. This is a highly detailed, incredibly vital narrative that a doctor usually finishes right before they lay a single hand on the patient for the physical exam. It's all about taking that messy pile of clues and organizing them so perfectly that anyone else reading the chart knows the patient's exact story. Just listen to how this reads. Subjective data. Patient reports intermittent headache for the past 3 days, rated 7-10 in severity, associated with dizziness and blurred vision, denies loss of consciousness, seizures, or recent head trauma, reports occasional numbness in the right hand, no family history of neurological disorders, sleep pattern disturbed due to headache. It's honestly incredible, right? You watch a chaotic, sometimes rambling conversation get transformed into clear, highly actionable medical intelligence.
So, we've mastered asking the right questions, we have the patient's story, but here's the thing: human perception can be misleading, and the nervous system, well, it's a total master of disguise. So does the patient's body actually agree with their story? What hidden secrets is the objective physical exam going to reveal that the patient couldn't even feel? Thanks for joining me on this explainer, and keep exploring how we decode the incredible human body.